Welcome to this series where I'll be discussing the 2026 ACC/AHA guideline on the management of dyslipidemia. This is Endo in a Bite, where I break down endocrine concepts or lengthy guidelines into focused, high-yield pieces you can actually remember. For the full board-centric framework, I've built it all out in easy endo prep designed to keep you efficient, current, exam-ready, and sharp in clinic. Visit www.ezendoprep.com to enroll in the full course or start your free trial. Today we are discussing lipoprotein goals for cardiovascular risk reduction. First, begin with the low-risk group. In this category, the targets are straightforward. LDL should be less than 100 milligrams per deciliter. Non-high density lipoprotein should be less than 130 milligrams per deciliter. apoB, if measured, should be less than 90 milligrams per deciliter. For primary prevention, this group includes patients with a prevent risk below 10%. If triglycerides are elevated, the apoB goal still remains less than 90. This low-risk category also includes patients with severe hypercholesterolemia, without familial hypercholesterolemia, without cardiovascular risk factors, and without subclinical atherosclerosis. It also includes patients with diabetes who do not have cardiovascular risk factors and do not have diabetes-specific risk modifiers. Again, the apoB goal in this group is less than 90. This category also includes patients with a coronary artery calcium score less than 100 Agatston units and below the 75th percentile for age, sex, and race. Finally, this group includes patients with elevated triglycerides who are younger than 50 years old and have no additional risk enhancers. Now let's move to the high-risk group. In this category, the targets are more aggressive. LDL should be less than 55. Non-HDL should be less than 85, and apoB should be less than 55 milligram per deciliter. This group includes patients with severe hypercholesterolemia or heterozygous familial hypercholesterolemia in the presence of clinical atherosclerotic cardiovascular disease. It also includes patients with a coronary artery calcium score greater than 1,000. For hypertriglyceridemia, this includes patients with clinical atherosclerotic cardiovascular disease who are at very high risk. Again, the apoB goal remains less than 55. Finally, this category includes patients with clinical atherosclerotic cardiovascular disease who are at very high risk, including those with chronic kidney disease. Again, the apoB goal remains less than 55. Now let's define the middle category. If a patient does not meet criteria for low risk and does not meet criteria for high risk, then they fall into the middle group. The targets here are easy to remember. LDL should be less than 70, non-HDL should be less than 100, and apoB less than 70 milligram per deciliter. You can try to memorize the individual categories within this group, but a more practical approach is this. Clearly identify who is low risk and who is high risk. Everyone else by default falls into the middle category, and for that group, the goals are 70, 100, 70. Let's break this table down a bit more. First, let's talk about primary prevention and align it with risk categories. We begin with LDL between 70 and 189 milligrams per deciliter in adults aged 30 to 79. Everything starts with lifestyle counseling. Then calculate 10-year risk and have a benefit-risk discussion. Now break this into risk categories. Low risk is less than 3%. Borderline risk is 3 to less than 5%. Intermediate risk is 5 to less than 10%. High risk is 10% or greater. Now let's connect this to lipid targets in primary prevention. There are only two target tiers here. First, the lower risk primary prevention group. In this category, the targets are straightforward. LDL should be less than 100 milligrams per deciliter. Non-high density lipoprotein should be less than 130 milligrams per deciliter. apoB, if measured, should be less than 90 milligrams per deciliter. This includes patients with prevent risk below 10%. Management here is lifestyle modification with selective statin use depending on risk discussion. Now, the higher risk primary prevention group. This corresponds to prevent risk 10% or greater. Here, targets become more aggressive. LDL should be less than 70 milligrams per deciliter. Non-HDL cholesterol should be less than 100 milligrams per deciliter. apoB should be less than 70 milligrams per deciliter. Management here is statin therapy, typically moderate to high intensity with escalation if goals are not achieved. Now, an important clarification. The 55, 85, 55 targets are not part of primary prevention. Those targets apply to very high-risk patients, typically in secondary prevention. So for primary prevention, keep it clean. 2 buckets only. Less than 10% risk leads to 100, 130, 90. 10% or higher leads to 70, 100, and then 70. This was another bite-sized episode of Endo in a Bite. Be sure to visit Easy Endo Prep at www.easyendoprep.com to sign up for the weekly newsletter and get the key clinical pearls delivered straight to your inbox. This time, I am ending this episode with an audio memory aid, a song, a jingle, to help you lock in the lipid targets 100, 130, 90, 70, 100, 70, 55, 85, 55. I have also placed a link in the show notes to the YouTube video, which makes these numbers even more memorable. Next week, we will continue working through this table of lipoprotein goals for ASCVD risk reduction, because in the full document, this is where much of the highest yield material matters. Let's get through this document one bite at a time. Here's your song.
If it's 100, 130, 90, draw the line. Best case scenario, everything's fine. 100, 130, 90, smooth and slow. Low risk lane, that's where you go. If it's 55, 85, 55, hold it tight. Worst case scenario, fight the fight. 55, 85, 55, take control. Highest risk zone, that's the goal. If it's not 100, 130, 90 today, not that easy, low risk way. And not 55, 85, 55 alive, not that edge where you strive. And it's 70, 100, 70, right between 70, 100, 70, steady and clean. 70, 100, 70, hold it tight, middle ground zone just right. 100, 130, 90, easy flow. 55, 85, 55, high risk goal. 70, 100, 70, center lane. 3 clean patterns, say it again. 100, 130, 90, say it clean. 55, 85, 55, lean and mean. 70, 100, 70, hit the scene. 3 number sets, lock the routine.
Get started today. Visit www.easyendoprep.com to make your purchase now.